As we go into the section on reviewing subluxations, I want to point out something, and that has to do with technique and individual styles of practice. I use X-ray in my practice. You may not. You may use a scan, you may use an examination, certain tests, and that's fine. It's important that you deliver your chiropractic to your patients. That's what makes you unique. In my description today, I'm going to go through some of the tests that I use, and I'm going to give you the tools in terms of how to use those. But the most important point of this is that you're going to review the subluxations both in a general sense and a sense that's specific to the patient. And we need to do both of those in this section. So we start with the general sense, and that's done through the subluxation models. I'm not going to go into detail on that here because I did that in the last module where we described the subluxation. We want to go back through that section and show the patient how the subluxations affect them. Where we're connecting the dots in this section is we want to make sure that they know not only that they have subluxations, but now we've actually confirmed whether or not they have degenerative disc disease, and we're going to be confirming how advanced it is. So we explain that first in a general sense. This is what happens with a subluxation. This is how it progresses into degenerative phases, and these ultimately can lead to spinal fusion, which can be debilitating. We explain that process. Then we transition over to showing the patient their own subluxations that are specific to them, whether it be through X-ray or through a scan or through your examination tests. We show the patient those specific subluxations that are personal to them, and we tie that together with showing them what phase they're in, what degenerative stage they're in, how far progressed these subluxations are for them. Make it personal for them because that's what they're here for. They want to know, how am I being affected by this condition? From there, we move into the neuropathylator. This is another way to review specific subluxations for a patient. You can use a neuropathylator, or you can use the spinal nerve distribution charts, the posters that show where the nerves go in the body. And you can use those in a way that will show the patient exactly how the symptoms that they have are connected to the spine and how those subluxations are directly correlated with the symptoms and the dysfunction in their body. So once we've made the brain-body connection after the general subluxation description, now it becomes specific to the patient. We make that connection. Now we move into the next description, which is the degeneration chart, the subluxation degeneration chart. I'd recommend you all get one. You can get those on the web, but it shows the phases of subluxation degeneration, and that's where we really paint the picture of this is how far advanced it is, this is how far it's progressed for you, this is where you're at, and more importantly, this is where you're headed. So we have to be very careful about how we lay this out, and if we do it correctly, which is the way I'm showing you to do it, then you'll easily progress into the section on projecting to the future, which is the next section. Got it? Let's go.